Five, four, three, two.
Okay, good afternoon. We are here for our weekly COVID update, and today we're having it on Thursday, really because of all the festivities, whether it's opening in the legislature or the inauguration yesterday. We went ahead and pushed this to today. We have a number of things to touch on, our traditional COVID information. I'm really going to focus today on how Albuquerque gets to yellow. And where we're at in terms of those key numbers. We'll also touch on vaccines, of course. And yesterday we did announce our finalists for our chief search. We are going to have a guest speaker touch on that as well. So let's go ahead and begin by talking a little bit about, as always, where we're at in terms of the city and COVID. And so let me change over to our slide to look at our key metric here in terms of getting to yellow. And I think I want to remind everyone that, we're going to talk about vaccines, but the other aspect on people's mind, of course, is that there's certainly a feeling right now, right? We all have hope because there's a vaccine coming out, and we also have a gazillion questions about all things vaccine. But I want to remind folks that, for several months, if not 6 months, we still have to deal with the actual virus and with people getting sick from the virus. And so it's very important that we also stay focused on that. And also from our business community to folks who want to go to work, we really want to get Bernalillo County to yellow. And so remember, there's these state color codes, red, yellow, and we want to get to yellow. That's when restaurants can open a little bit and things just get a lot easier for city services and so forth. And whether it's, different things we enjoy for fun and for recreation or for sports, all of these activities, everything, right, according to the public health order, is based on the status. And so we need to get our situation from red to yellow. Now, if you look at this, as we've been mentioning for quite some time, if you look at the one criteria, positive cases per 100,000, we've got a long, long ways to go. I mean, this is months away. And you can see those figures there. Again, we need to get to 8, and we're just very far from that. However, there is some real hope with respect to positivity rate. You see sort of the last every 2 weeks, we get the sort of state official number, and then we kind of estimate it in between weeks. And our estimates are looking much improved. So the last reading at 10.54 for positivity, and we need to get to 5. We did see in our last update, right, we were at 9. So we saw a little bit of a downtick there. And then we're hoping, again, our sort of unofficial statistics, that we'll continue to see a downward trend. And this is especially important because now we're in the window of where we might be seeing the results from holiday related spread. And so if these numbers continue to go down a little bit, even though we're seeing the results from holiday spread, I think we're going to be in a very good position when it comes to positivity rate. So that leads me to a little bit of a discussion on how we actually get to yellow. And I think it's important to understand there's 2 ways. A lot of us, including myself, I'm like, oh, vaccine's coming eventually, we'll all be yellow and green and this kind of thing. That's the long way to yellow. If we vaccinate our way to yellow, we will be in yellow in October or something to that effect. That is the slow and obviously more dangerous way from a public health perspective. The much healthier way and faster way is to just follow the simple formula that we've been mentioning. You got to follow the public health order with respect to mitigation. So masks, distancing, these kinds of things, and then testing, right? Testing is so important. And it's important because of a couple of reasons. Number one, so we can accurately understand where our community is at, do all the forecasting for hospital beds and things like this. But also because if you are positive, to quarantine, right? And that's how we actually reduce spread. And so it's that combination, following the public health order guidelines, getting testing, and then quarantining if you're positive. That's how we get to yellow. That's how we could get to yellow in March. We will never get to yellow by just waiting for the vaccine that soon. So you can, I think, see these real two paths. So it's very important that we continue to watch that. And I think it's a good segue too into where we're at in terms of testing. Now, as a reminder, when in doubt, go get tested. We have testing locations all over the city. We have a 48-hour turnaround for most of them, if not sooner. We also know that there's different methods now you can get, and all this information is available at the state hotline or available by calling 311. And some of them take reservations, some don't. And the point is there's a lot of options, and there's even some options that of course are through different private providers and so forth. So these are just sort of the public options in the metro. And for us, again, if you think you've been exposed, or if you know someone who's exposed, or if you know someone who is exposed to someone who is exposed, or if you have any of the symptoms, these are reasons why you should go get tested. So when in doubt, please go get tested. Okay, now the reality around this, again, to just emphasize this one more time, is that there is a long road to yellow, which is waiting for the vaccine. There is a much shorter road that we can do in Albuquerque and in our surrounding areas where we can get to yellow and we can have those kinds of activities available to us again. We can control that as a community. And it's by following the public health order, by getting tested. And again, if you are positive, please quarantine. And that includes family members who've been exposed too. So, we don't, the situations where it's like, well, my wife is positive, but I'm not. And so I'm going to the grocery store and this kind of thing, that all increases spread. So we really want to encourage people who are positive to really follow the quarantine guidelines outlined by the Department of Health. Okay, so let's transition a little bit to where we are at on vaccines. And so a couple of things, vaccines and testing are being handled in different ways, and especially because they're also in different phases, right? We're just starting vaccines. We've been doing testing for quite some time. And so right now testing is really, it's a state level, vaccines are a state level sort of program. And so if folks have questions, of course, we'll try and answer them, but we want to encourage people to call the experts right now on vaccines, and that is the state of New Mexico. So you can go to that state website, vaccinenm.org. You can also call this number 1-855-600-3453. And as a reminder, if you have questions about vaccines, this is really the only authoritative source to go to in New Mexico. And I'm also saying, if you have questions about testing, 311 would love to take care of you. And so would the city's website. If you have questions about vaccines, it's a little different. You should really just use this number because there's a lot of misinformation out there. And also the state is just right now the primary coordinating entity. So the city is probably not going to be able to answer a lot of your questions as well. So really want to direct you to the place you can get actual answers that are correct answers. And that would be the state of New Mexico. Now, you can also register at this number, of course, on this website. And I want to mention too that, this is not just a phone number or registering on a website. We do know that over 30% of the people who have registered have gotten a vaccine. So this is literally the primary and best way to get that vaccine is just make sure you're registered. And so that process is, of course, in the works. Now, I do want to take a moment just to acknowledge that there are many channels to get a vaccine. This is the one everyone should use by default, even if you have other channels to get it. And this is also what we're telling our city employees as well. Now, we do know that, there are some fascinating things happen, right? Like I know personally of folks who are getting called by Walmart pharmacies and they're saying, hey, we've got some vaccines. I know people who are getting called perhaps by a private doctor, private provider. Hey, I got some vaccines, and we also know that for folks in government, there are different government channels as well for healthcare workers and first responders and things like that. So there are a lot of different channels to get a vaccine. I think the important thing is that everyone should be in this channel. That is what's most important. And I also want to acknowledge that, notion of 1A and 1B is strong guidance from the state, and it's how people are trying to do things. I also hear about all the different situations that are happening sometimes with like these leftover batches where people are like, I've got 4 vaccines and we have to use them in 6 hours. I just want to emphasize, I think, one point. The important thing is to get vaccines in arms. And as long as this is, 80% methodical with respect to the tiers and so forth, as long as that other 20% gets in people's arms, that is a good thing. And of course, over a couple of weeks, that all kind of washes out. So I do want to acknowledge that this notion of these sort of no-shows or what happens, people will schedule appointments and then there's no shows and they've already opened up the box of vaccines and they want to get them in people's arms. That's certainly something that's happening. But again, it's a very tiny number with respect to all the others. Last thing I'd mention is that I did check on the Pitt site. That would be our basketball stadium, the vaccine site, and was just grateful to see it up and running yesterday. And of course, that's a very high volume location that is the public and again, being run through this website and this number and so forth. So, but just know that like there are hundreds going through there, at least there were yesterday, if not thousands over the upcoming weeks. So I think we're optimistic that, we're going to be able to get this done. But it's going to take a little bit of time, and sometimes it gets a little confusing, no doubt. Now, the city is ramping up really on how we do the sort of general public in phase 2. So just in terms of like who's handling what, it's really kind of the county and different hospitals and then the state who are involved in areas 1A and 1B, a little bit with our emergency operations center. The city really, like, when can I go to my community center and get a shot? That is going to be in phase 2 or group 2, which, we hope will be this summer. And the city is ready. So as soon as we get the shots, we're ready to open up a dozen or so sites within days of getting those shots. So we're excited about that. Now, a little bit about just a city employees update. We've got about 600 city employees vaccinated, all based on our emergency operations center protocol. That's about 300 firefighters. We're up to about 200 police. So we're very glad to see that number going up, and about 70 other city workers. I would really just wrap up, I think, this by saying that we also at the city, we think we have in the works, at least several hundred each week, again, based on the criteria and our emergency operations center. So we'll continue to be doing that. But for everyone, the best bet is that PowerPoint right on your screen. So with that, let's do this. Let's transition a little bit to our chief search. Again, this isn't directly COVID related, but it's always helpful to have firm and final leaders at the top of any department, including our police department. That said, Interim Chief Medina has been doing a very good job in that role, but we continue with our chief search. And so we did share that we are down to 3 finalists. And we want to continue pushing on this. It's been very difficult during the time of COVID to do all the things that we want to do, including recruiting and so forth. But we think we've got 3 good finalists. And I think that's a great thing for the city of Albuquerque. And, the goal of our search is really that, we need to find the right leadership for the city of Albuquerque in terms of public safety. That's our primary goal. And we know that means a couple of things. It means leaning into DOJ reform and making real progress there. It means real progress on fighting crime, because we have plenty of crime challenges as well. It also means continuing to bring the department up to full strength after almost a decade of it being drained of a lot of resources. Now, for us, these are obviously, as mayor, these are decisions that I'm entrusted by the folks who voted in Albuquerque, and the mayor does do the hiring and firing of all mayoral appointees. And so whether it's a Parks and Rec director or our CAO or our COO, I do acknowledge these decisions fundamentally come down to me. But we've tried to put together a thoughtful process that involves lots of input. And so that process has involved a number of community groups who've been involved, number of individuals, including a public forum we're going to have. So I want to announce Saturday at 1:30, we're going to have a webinar with the finalists. And you can find more information at cabq.gov/policechiefsearch. And the finalists are, of course, I'll just use their civilian titles. Clinton Nichols, Joseph Sullivan, and Harold Medina, and their resumes are all online, including their references. Of course, we have redacted personal information. So that's for the public to take a look at. Now, more on this process, we're going to hand it over to Herb Crosby, one of New Mexico's own, but who's been helping out with a number of searches throughout his career, but also some of the key ones at the city of Albuquerque. Herb, take it away.
Thank you, Mayor. To your point of the goal for what we're trying to do, to find the best qualified person for our police chief to help us in our city. We felt that it was crucial for our team to hear from as many people in the community and organizations as possible. Since October, we've conducted more than 40 virtual sessions for input with a wide range of community leaders and community organizations. We also have received nearly 2,500 responses to our online survey, of which this report has been released to the public. As you can imagine, doing sessions with 40 organizations, we've collected a lot of information. There were several themes that consistently emerged from these input sessions. And Mr. Mayor, I just want to enumerate just a few. Certainly don't have time to go over all of the themes that we were privy to, but these include, and not limited to, having a chief with a visible presence in the community on a regular basis, increasing the APD's transparency within the community, focusing on behavioral health and public health issues, prioritizing de-escalation tactics, and having a broad understanding and commitment to racial equality. We encourage the public to provide input at any stage of this search process, including suggestions and questions to be asked to the finalist. And you can go to Chief Search Input at cabq.gov. Thank you, Mayor. Back to you.
Thanks so much, Herb. Appreciate all your work on this process. And again, there's more information available online on this, including our summaries of the input. There's a multi-page report of who all was involved in that process and our efforts to define really what should happen going forward. So with that, let me just mention that, if you, a couple of closing items. If you are offered a vaccine, just take it. I think that's really important. I do believe it's important to get. Obviously, it is a choice. We acknowledge that, but I would encourage people to take it. And again, the sooner you take it, if it's offered, the sooner we can push through and continue. So would appreciate everyone's effort with that. And also a reminder that details around your health records and your private health information are all protected by federal HIPAA laws. And so you want to make sure that these are designed to protect people from discrimination when they're seeking health services, and no one has the right to know your personal info, including whether or not you've been vaccinated. That is your personal, again, protected right. So remember that too. We don't want to have any situations where there's any kind of personal, any casting of dispersion of any kind on people who choose one way or the other. Okay, with that, we'll try and take a few questions here.
Okay, and it looks like we have one from Ryan with KOB. Ryan, go ahead and unmute and ask your question.
Thank you. Can you hear me, Mayor Keller?
Yep, go ahead.
Perfect. Two questions for you. One, have you been vaccinated yet? And the second one is, we know the state is really handling the vaccination effort, but do you have an opinion on, I don't know, the equitable rollout of the vaccine? We know there's some school districts right now that are working on getting it. Some are, some aren't. People are worried about, who might get it first. Do you have an opinion on how we should be equitably rolling this out? Or I know it's not a city effort, but I'm just curious, as the leader of Albuquerque, where do you stand on the issue?
Sure. Well, I know, number one, it's difficult. And so I really feel for the state on, they're under a lot of pressure, obviously, to do this and to do it in the most equitable way possible. And I know they're trying very hard to do that. I also know in any kind of emergency response situation like this, you're really aiming for, let's say an 80%, getting the job done right. And the 20%, you just got to get the shots in the arm. So I think you got to solve for volume up first, number of shots in arms, and no shots go to waste. That's the first goal. And then, of course, equity comes right after that. And so, look, I'm concerned about all the different inequities that I hear about, but I also know they're happening all over the country. And, pandemics are messy. So it's not really in my place to, suggest alternatives. And because I do think they're doing the best that they can. And I certainly know they care a lot about equity. And so we're just trying to support as best we can those efforts. Oh, and to your question. So as per our emergency operations center, I was offered the shot and I did take it, and would encourage everyone to do the same. And that fits in those, the numbers of different individuals and totals that we shared earlier.
Thanks, Mayor Keller.
Okay, next we have Elise from the Albuquerque Journal. Elise, go ahead and unmute and ask your question.
Hi, yes, thank you for taking my question. My question is, how does this search for the chief of APD compare to the last search right after you got into office? And are there things that you're doing this time around that you did not do the first time? And can you just compare the two strategies?
Sure. The question is about, sort of what's changed from the last time we went through this. And I would mention a couple of things. The biggest difference is the pandemic. So, I think Corona has resulted in two things. One of them is actually positive. I think we've been able to take a lot more input and talk to a lot more people. And that's basically because it's just easier to coordinate a Zoom call than it is, a bunch of different meetings at the convention center. And so I think that's a positive piece. The other positive piece, I think, now being in this job for a while, I know a lot more what we're looking for. Look, before, when you first come in as mayor, you want someone who you think will do a good job, and someone who you obviously believe in the future, but you don't know a whole lot more than that, right? You're not familiar with the details. You're not familiar with how the department works, and you haven't had the benefit of several years of critiquing from the DOJ or others, or even crime stats. So I think we are in this process much more eyes wide open, and also in many ways much more flexible to solving for what we need, as opposed to just, hey, this person we think will do a good job. This is different. We are really looking for someone who meets the specific needs of our department, as opposed to just someone who on paper is a good chief. And so those, I think, are some of the differences. I would also highlight, you didn't ask, but I know a lot of people question, they're curious about like this process versus superintendent of schools and things like this. And, as a reminder, what's interesting is this is a departmental hire. I mean, technically and legally, it's the same. We only have to do the same thing we would do for whoever we pick to run the Parks and Rec department, or whoever we pick to be CAO, who's like the woman in charge of the city. And so we did this time, though, want to make sure and offer the opportunity for input. And so we did that, again, just to make sure we're aligned with the community. And I think that's very important. But also, as a reminder, the technicalities of this, or it's a very straightforward choice just under the charter that the mayor's got to make.
Thank you, Mayor. Now we're going to go to Brittany from KOB. She has a question on the chief search. Brittany, go ahead and ask your question.
Hi, thank you. I have two questions really fast. The first question is, I know that obviously you said that you make the final decision. Obviously the community had tons of input, but I'm wondering, are there any other individuals maybe within the city or even outside of the city that have helped maybe narrow down that list to the 3 finalists and who will ultimately help you make a final decision? And if there are some other players, who are those people? The other question is that we're hearing that more people are leaving the department as a result of the latest monitor report. I thought it was interesting in the results from the survey that some of the community members kind of put the DOJ as not super important. So I'm wondering, for you guys, you know, how crucial is it that someone is hired with perhaps experience in handling some of these DOJ reforms?
Sure, good question. So let me try and separate the two and speak to them. The first one with respect to the process, certainly we could put you in touch with Herb, who was on earlier, to speak to that, and also send you the list of different entities, but they are listed in terms of, you know, the Crime Stoppers Group, the Downtown Community Safety Coalition. We got input from all our CPCs, the Chambers of Commerce's, the Center for Peace and Justice, Asian American Association, the neighborhood associations, and Moms Demand Action, and Praise, Sankofa, Transgender Resource Center, LULAC. These are all entities that have been part of the process. And for me, what I try and do is I try and gather input, and our executive team, as we would with any key hire, that is really who's involved in kind of the final round of interviews and came up with these 3 finalists. And at the end of the day, of course, they wouldn't be my executive team if I didn't listen to them the most. So their input is very important. But I certainly take into consideration all the input. And to get to these 3, we've really leaned heavily on the input that we've gotten from these groups. Yeah, at the end of the day, it's just the way the city of Albuquerque government runs. I get to pick someone, and I get the responsibility of that, whether it's good or bad, or whether the outcome is positive or negative. In Albuquerque, it's fundamentally the mayor can pick whoever they want. And so we've tried to put together a thoughtful process that gets to a really good outcome. But ultimately, I know it's on me. So the second part of your question is, you know, I really struggle with a 2-parter.
DOJ and the monitor.
DOJ and the monitor, yeah. So yes, what you see in the input, I think, is a reflection of where the city of Albuquerque is at. There's a huge group of people who are concerned about crime, and they're saying, look, we've got to get a handle on crime. There's also a large group of people who are concerned about reform. And I think fundamentally, we're all concerned about both, right? And I'm certainly concerned about both. And so for me, really, I need a police department that can do both, that can actually lean into reform and make progress on reform, and that can bring crime down. And that's also why this is a very tough decision, because you don't usually find a singular person who has high expertise in both of those areas, you know, and also wants the job, especially in these tough times all across, you know, the country, where we do see law enforcement numbers decreasing. So for us, you know, we're just going to come up with the best people we can out of the finalists that we have. And that's our goal. And I think we can certainly, that's possible with the group that we have. But there is no unicorn. If there was a magical person out there who is awesome track record on reform, and the best person on reform, and the best person for bringing crime down, and someone who knew and understood our unique community, I would just already hire them. We wouldn't even have finalists. The reality is there is no perfect candidate out there. So the last thing I would mention on that is, I think too, we need to recognize, you mentioned that, you know, officers may be leaving or not. We do track all those numbers. So I do know this, we have not seen anything that we did not forecast based on retirements, people reaching their high 20 and so forth. Now, that doesn't mean a few folks haven't done what you articulated, but you'd have to ask Gilbert over at APD, like specifically about what you're referring to. I'm certainly not aware of any particular exodus or anything like that that wasn't based on just people meeting their para goals.
Mayor,
Thank
can I
you.
get feedback on the first part of her question?
Of course. Yeah. Thank you, Herb.
Yeah, Brittany, we made sure that the three finalists had experience in dealing with the DOJ, number one. Number two, we were able to get feedback from the community about specific questions that we crafted related to team building in an organization. If the person that comes in is from outside, how do you do that? And even the person that may be selected from within. And also we talked about dealing with morale problems. The three people, morale and motivation. So Brittany, the three people that came up to be the finalists all had very innovative and creative ideas in terms of how to deal with morale, conflict, and how to motivate their team. Thank you, Mayor.
Thanks, Harold. I mean, Herb, I appreciate it. And
Thank you.
I think we'll go back to our moderator here.
Yes, we've got another question from Elise on the chief search. Elise,
yes.
go ahead.
Thank you. This is Elise from the Albuquerque Journal. I'm just wondering about how the search for the chief interplays with the search for the public safety director. Is it possible that you interview these three candidates, or like after Saturday, it turns out that one of them would be good for the chief position and one would be good for the director of public safety, or is that an entirely different set of qualifications?
Sure. There's a lot of overlap between sort of the initial concept and the job description, and that was by design. I think we do need to look at this in aggregate. And so the answer is we're totally considering both at the same time. And so this process, you know, we know that we wanted to provide an opportunity for the community and so forth. But if those individuals are particularly interested in that other role, we will certainly have a discussion with them, and vice versa. If we're like, you know, we're interested in talking about this. So after this round of forums and so forth, that's really when we'll walk down that path. I think for right now, we're just curious about the final aspects of community input, and then we'll start thinking about both roles and where we want to go.
Thank you, Mayor. The last question comes from Chris from KRQE about vaccines. Chris, go ahead and unmute.
Okay, thanks very much. I wanted to also actually, while we're on the chief topic real quick, throw in a couple ones that I thought up while I was waiting here. Can the people of Albuquerque feel confident that the city, out of its three candidates, has at least one that would be a great chief? Is the right candidate among the pool right now? When can we expect a decision on the new chief as well? And just a quick vaccine question that I am not entirely sure you may have the answer for. Do you happen to know how many vaccines have gone into the Bernalillo County region so far, and how many have been given out? You mentioned as well kind of all the different avenues people getting for the vaccine. We're hearing a lot of stories as well about people getting called after the fact of their appointment scheduling, a pharmacy calling saying, hey, we've got extra shots. You mentioned it's just important to get those out, but you know, do you at all see a frustration there that you know, there is that sort of moment happening where it seems a little chaotic, I guess, in the rollout of this sort of vaccine? Thank you.
Yeah, sure. And so talking about those, I do think any one of these three candidates is certainly capable. And I think you'll see they each have different strengths. And so I think, but the good news for the city is we got three good candidates out of the process. I think that is clear. And again, they all have different strengths, and, you know, by extension, they all have areas where they don't have as much experience in. And so I think we've actually got a pretty good choice to make. Now, the question about your second question, there isn't county, we are not either at liberty to say or aware of specific county level data with respect to vaccines. So you'd really have to ask the state of New Mexico for that one. And, you know, I would say, look, I think what I was trying to reference earlier is that, yes, like this process is fascinating. I mean, I know people who've gotten the call from Walmart after they got the other shot and this kind of thing. And that's why I think it's important to remember two things. Number one, if you get the opportunity, you should take the shot. And then obviously, when someone else calls you and says we have a shot ready, you should get out of that system so that someone else can get it. So that's first and foremost. And the second thing is, I think we just need to remember we're in a crisis. We have a pandemic. And so I do expect a level of, not everything is going to be totally perfect and consistent and so forth. It's just not the way crises work. And so I think it's important for all of us. It's frustrating. And I know that, I live here and have family and these kinds of things too, but it's important for all of us to understand that as long as shots are rolling out, right, as long as there's a line around the pit, like I'm happy because eventually it'll work itself out. And some of these details, I just think in some ways they're unavoidable. You're trying to vaccinate America and that's not going to happen perfectly. There's going to be some bumps in the road.
And really quickly, any idea of when a decision on the chief might be happening?
Yes, you're throwing three at me at the same time as you're just raising the bar even higher. So yes, a decision. I really want to make this decision soon. And I've said this from day one because I just think it's important for the city of Albuquerque. So I do want to continue to move pretty fast on this. So I would like a decision to be made before March. That's my goal. Now, I will just caveat that if all of a sudden all three candidates say they're not interested, then we got to go back to the drawing board. Or if in the negotiation process, there are hiccups that are discovered and so forth. But that's certainly my intent. And I'm very excited that at least today we're on track for that. So we'll knock on wood that we can be able to wrap this up in February. All right, I think that's all we have for right now. We will see you again next week and take care.